So knowing and understanding your blood pressure is the first step. So I think what people always ask me is, well, what does the top number mean and what does the bottom number mean? So the top number is going to be your systolic blood pressure. So that is the amount of pressure that the blood is exerting on your arterial walls when your heart is contracting. So that means when your heart is beating. The bottom number is considered the diastolic number, so that is going to be the amount of pressure that is exerted when your heart is relaxing. Some of the key factors that you want to know as far as blood pressure is knowing what values are normal and what values are elevated, and then where we run into what's called hypertensive crisis. So the target blood pressure that we would like to have is less than 120/80. An elevated blood pressure is when you have that top number in the 120s, so if you're 120 to 129, and then that diastolic, so the bottom number is still less than 80. Stage 1 of hypertension is going to be 130 to 139 over 80 to 89. Stage 2 of hypertension is going to be anything 140 over 90 or greater. And then hypertensive crisis is actually anything 180 over 120 or greater. Factors. So if you have elevated blood pressure, you run into issues potentially increasing your risk for heart attack, stroke, kidney dysfunction, things of that measure. And then modifiable risk factors is getting up and moving. Try to find some way to exercise and move your body in some form of way, shape, or form daily. Sedentary lifestyles can contribute to elevated blood pressure. Make sure that you're choosing fresh fruits and vegetables, eating a good, balanced, healthy diet. Also, low sodium diets as well. Sodium can increase your blood pressure.